From the treatment scheduled follow-up bucket, we can mark a patient as treatment started. When we mark a patient treatment started, they move through this flow and this process here, which we call the post-op management action bucket, which is a bit different than the other buckets that we've looked at because there's some flexibility and variability in the processes depending on what type of practice you are. So we've made it very flexible and very open as to what you can do. So this is the way it goes. We go from treatment scheduled follow-up, and we say in treatment scheduled follow-up that treatment is started with a date, and it moves here into treatment started. If treatment is started, then we need to generate a post-surgical letter because we've had the treatment, the surgery, whatever's happened. So there's a notification which automatically goes out that sends a task to the correspondence bucket saying you need to generate a post-surgical letter for this patient. Then we move right into post-op management. And post-op management is where our referrals / patients will land when they've had their treatment. Here we can decide what to do next with them, and there's a lot of different options, and depending on the type of practice you are and how you handle your patients after treatment will depend on how you use this bucket, but we've made it very flexible so you can use it, set it up to use however works best for your practice. So sometimes the treatment's done and we're ready to restore right away. So if that's the case, we can just hit the ready to restore button. But then also many times we want to say, okay, they're ready to restore, but we're not done with them yet. We still need to see them again, or we need to do something more with them. The referring doctor is ready to restore, but we still have maybe another hygiene visit or something else that we need to do with them. So we want to keep an eye on them, and we don't want to mark them complete yet. So in that case, we'd move them to an observation bucket by giving them a date. We want to see them again in 6 months. We'd set that date for 6 months. They would move down to the observation bucket out of our post-op management bucket. Let's say in 6 months they come for their hygiene visit, and at that point we determine that they need additional treatment. So then we could mark them additional treatment scheduled. This would push them back up into our flow, into the treatment scheduled flow, where they would start the process all over again and go through the same process. The whole time the referring doctor is being notified and can see everything that's going on, which is the benefit of using Referral Raven and keeping it really updated and all the notes and everything up to date. So we're in post-op management. They come back, let's say they've come back after their 6 month and everything looks good. They had their hygiene visit, and we want to mark them as treatment complete. We push them here to treatment complete. The referring office gets the notification that treatment is complete, and we generate a task in our correspondence bucket that says we need to generate a treatment complete letter. These letters are all set up so we make sure we don't miss or are delayed in any of the correspondence back to the doctor, so they get everything in a timely fashion, and the people who are handling our correspondence have a good system to be able to handle and take care of any correspondence that we do within our practice. So they go into treatment complete, the correspondence note is generated, and that patient has finished. The doctor is notified, and this patient will actually show back up in the referring doctor's open new bucket so that they can call and schedule them for a crown or whatever else needs to be done.